Hi everyone, I'm Nermi Santiago, an international dental student from the Benemérita Universidad Autónoma de Puebla in Mexico. And this research is about frequency of patients with negative behavior according to the Frankl scale under dental management. First of all, as introduction, we got the Frankl scale in pediatric dentistry allows us to classify attitudes and behaviors in children when faced with dental treatment. According to this Frankl scale, as we can see in the figure 1, patients with grade 1 and 2 are not very cooperative and require more complex attention, challenging the dentist to use different techniques to control this behavior and thus guarantee a successful treatment. A good management of the patient by the dentist generates a change in the patient's attitude and stimulates interest in oral health care. In the figure 1, we got the Frank behavior scale. It's divided in 4 grades. The grade number 1, definitely negative, a patient with a behavior refusal of treatment, crying forcefully, fearful, or any other evidence of extreme negativism. Then we got the grade 2, a negative patient, reluctant to accept the treatment, uncooperative, some evidence of negative attitude but not too pronounced. Then we got the grade 3, it's a positive patient, acceptance of treatment, at times cautious, willingness to comply with the dentist, at times with reservation, but patient follows the dentist's direction. And then we got the grade 4, a definitely positive patient, good rapport with the dentist, interested in the dental treatment, laughing and enjoying the situation. The objectives of this research are to evaluate the frequency of patients with negative behavior in the pediatric dentistry clinic of the Benemérita Universidad Autónoma de Puebla, Tezitlan campus, to know the management techniques most used by the students, as well as the change of attitude in their patient and the success of the treatments performing on them. Methods and material. It was a cross-sectional and descriptive study. A questionnaire was conducted to 43 students in their final year attending pediatric dentistry clinics at the Tezitlan campus to find out the frequency of negative patients, the techniques used for the management, and how the patient's attitude influences their treatment. And we got in the results that it was found that at least 1 out of 3 patients presented a negative attitude, most frequently grade 2. The tell, show, do technique is one of the most used by the students. However, they report that some techniques such as distraction, voice control, and positive reinforcement are insufficient for adequate management since they cause little change in the patient's attitude. Only 33% of the respondents feel prepared to attend patients with negative attitude, and 55.6% have left treatments unfinished because of patient misbehavior and/or operator mismanagement, which leads to the treatment failure. Discussion. Patient behavior is very important for a successful treatment. Negative behavior and poor management by dentists causes unfinished treatments, prolonged appointments, formation of erroneous stereotypes by the patient, and a lack of interest in oral health care, becoming a population at high risk of developing oral diseases. The inadequacy of some techniques may be due to generational psychological changes facing children who are more difficult to control day by day. In the conclusion, the negative behavior of pediatric patients represents a challenge for the dentist, but it should not be a limiting factor in their care or a factor of failure in the treatment. Good management of the pediatric patient is the key to success. However, some of the management techniques nowadays are insufficient for the adequate management of patients with negative behavior. The lack of preparation to the management of negative patients by the operator results in a neglect of this type of patients, being vulnerable to oral diseases and to develop a lack of interest in their oral care. This study gives the ways to new research to improve the techniques for the management of pediatric patients in the dental office, consider the generational psychological changes, the participation of the guardian, and the use of technology in the dental office. So thank you for listening and watch this video about this research. Thank you.